Good day, everybody. Welcome to Dental Voice Season 2, the finale episode. My name is Rolando Mia, and this is Zyris. The purpose of Dental Voice this season, or all our seasons, is to hear from professionals in dentistry, get an understanding of the things that they're experiencing, their opinions, and most importantly, their advice regarding stuff that they're dealing with today. And what I'd like to do is share with you everything basically that we've learned over the past 5 months speaking with our guests. First of all, I'd like to, on behalf of Zyris and our team, thank all of the guests who showed up on our show this year. It's amazing to think that in a crisis with all sorts of crazy things going on, people were willing to take the time to get on, speak to us, and share what they were dealing with. Let me share with you a couple stats before we jump into this. First of all, we had 48 episodes, 48 different guests on the show this year. And I'm thrilled to say that every single person contributed something meaningful and important to this, which was amazing. We had a mix of men and women, almost 50-50, which is incredible. When you look at the population of guests, we had, out of that 48, I believe, 33 dentists. We had registered dental hygienists. We had dental assistants. We had team members, front desks. We had patients, dental students, and we even had industry leaders. Thrilled to have Stanley Bergman, CEO of Henry Schein, join us and share his perspectives on what's going on. And for that, we're grateful, and we're really, really, really happy about the fact that in every episode, something meaningful came out of that. So how would we summarize this season or this last season? It would come up, the key summary for this would be this. 2020 was gnarly. Now, it was really hard. The message, the sentiment, the things that we went through in 2020 are just absolutely incredible. Starting with a pandemic, which kind of was the catalyst for everything, to all the other crazy things that are going on. It's amazing to think about what we've been through. Actually, I was told by some of our friends over here that 2020 is a kind of a reset, which means my birthday didn't happen, which means I have another year. So everyone is a year younger. So 2020 was hard. And because of that, we faced so many different things. And the feedback that we received really helped in kind of framing my mind, in how to deal with that. So what are the top 5 learnings that came out of speaking with 48 different professionals, incredibly knowledgeable people in this industry? The first one is all about communications, effective communications, and utilizing tools that are available, some kind of digital format. That's kind of where things are coming, where things are today, because of our quarantine, because of the fact that we don't get out. Digital format using social media, electronic means, things like email, e-newsletters, that type of stuff. Teledentistry is becoming a big thing. So one of the biggest key learnings is that it's here. And the more we can communicate, the more you can communicate with your patients, with teammates, with colleagues, with community. Very important. Second, it's all about safety. It's funny, we know about safety, and it's not about, no, safety. And I think Michelle Strange said it the best. Can't stress the importance of upping our infection control game. COVID basically reinforced the importance of basically not becoming complacent with infection control protocols. What happens is it's been done, or the dentists have been doing it for so long, it's okay. But the moment something gets off or people become complacent, things happen. It's not also just about clinicians or people in dentistry. Patients are watching and they're paying attention. So number 2 has to do with safety and this whole context of upping infection control game. Third key learning and message that came from speaking with our guests is this context of planning, but not just planning to plan. Love this context. Plan to thrive, not to survive. You're going to hear comments from our guests, pearls, that they said this idea of planning to thrive, not to survive, is this idea of plan with a courageous, a forward-thinking, positive mindset. Can't reinforce enough that you can't do anything with what you don't know. And it only increases the amount of stress that's in there because of the anxiety of, oh, what do I do? Focus on what you do know, and then start by establishing a context, a plan to thrive. It's funny. That message came across multiple times, and the doctors who are doing that are thriving, are actually doing well. Number four, COVID has really reinforced this context of linking oral health to systemic health. When people have shared with us, and we've seen studies and all this information showing that when people have good oral health, it ties directly. There's a very, very high correlation to good systemic health. And I think what the sentiment and the message that we got from our guests is that as a catalyst, it's really highlighted how important it is that it starts. Starting out, dentistry was considered non-essential. It is essential, and the message is very clear, and it does help patients. So there you go. Oral health tied directly to systemic health. Very, very important. The last thing is more about a message about us as people and about kind of the learnings that we've had going through a crisis, through a pandemic, and kind of the craziness that's going on. And that's remember your why. And remember that Dr. David Rice with Ignite Dental, he shared this with us. Your why. We work to live. Remember that we're working to live. We don't live to work. This context of a meaningful work-life balance is very, very important. And when we get too much to one side, what happens is we become incredibly, incredibly stressed. The other thing that came out very strongly with regard to this work-life balance, this why, has to do with don't worry about getting back to 100% capacity. What we learned from our clinicians is that, practices are still going to be successful with fewer patients, and we can get into that. So 5 things: communications, safety, upping our infection control game, plan to thrive, not to survive, this whole idea of oral health and systemic health, and then remembering why, enjoying your life. It's amazing when you think about that. So every one of our guests shared with us some incredible pearls of wisdom. What I want to do now in the next 15, 20 minutes is share with you one pearl from every guest that we had here. Now, they shared, we learned so much from them. I personally learned so much from them. And I would encourage you, if you have the time or when you have the time, to go back to watch the episodes and listen to the messages that our guests have been giving us, and some of the incredible things from the dentists, from the patients, from the hygienists, all the struggles that we've been going through. So take the time to do that. What I'd like to do now is from each person. So here you go. You guys ready? Kind of excited about this. And there's a lot more. And if I miss something, I want to apologize in advance. But the things that have come out are amazing. First of all, Dr. Jason Auerbach is an oral surgeon, Riverside in New Jersey. The one pearl he says, pay attention to what's going on. Because he has friends in Europe. He saw what was going on, and it enabled him to get ahead of the curve. And because of that, he was able to sidestep a lot of the issues that some of the other dentists have. So this idea of paying attention, it's there. Dr. David Rice, a dentist in Elgin, Illinois, when the pandemic hit, instead of getting kind of freaked out, kind of settled. And the key thing he shared with us is invest in what you know works. He became part of a group, learned, and instead of knee-jerking and kind of getting everything, calm down, invest in what works. We had a patient on, Dorina Lapkova. I don't know why, but this resonates so much with me. What she shared with us is this. As clean or as immaculate as your practice may look, if it doesn't smell clean, people aren't going to think it's clean. So that was one of the pearls that you came out with that just blew me away. Now I'm smelling everything. We have Dr. Robert Raimundi with One Manhattan Dental. Holy cow, that group is pretty cool. The pearl that he shared with us, this context is patients react to those around them. In other words, if you're freaked out, as much as you make believe you're not, people are going to feel that that's the case. And then the partner in that office is Dr. Mark Scafani. And his context is dentists shouldn't fear the unknown. Stay focused on taking care of the patients. Stay focused on taking care of what you do and why you do it. And because of that, it gives you kind of a core strength, and you're going to be fine. We met with and were introduced by a dental student, Laura Sunmore, who is a dental student at the UNC School of Dentistry. Amazing, amazing person. She, applied a million times to school and wasn't accepted. Finally got in. Now she's going to be graduating, and she's going to be a phenomenal dentist. Her comment is, don't sweat the small stuff. Don't fear what you can't control, because you can't do anything about it. Keep asking questions. Have the courage to do that. I love that sentiment because it's gotten her through, and it helps me focus when I kind of get a little freaked out. We met Dr. Miguel Ortiz with Lit Dental. He implemented negative pressure rooms in his practice. And the context that he shared with us is this: do what makes sense based on what you believe and the science and research you find, rather than wait and do nothing, because then you end up doing nothing. His practice is doing well. His patients are safe. He's comfortable. His team is comfortable. Really love it. And then we met with Dr. Paul Goodman, Dr. Nacho, Dental Nachos. What an incredible group of people. He shared a whole ton of beautiful things with us. Here's the one pearl I got of that. His context of TSD, that's so dentist. Rather than focus on what's going wrong, which increases stress and makes things all crazy, focus on what's going right to help reduce that stress. I love the sentiment around that. It helps in framing what we need to do. We then met with Dr. Maria Sebastian with Dentistry with a Smile in New Jersey. The thing that she said, I love it. Focus on what you can control. It kind of ties back to some of the things we were talking about earlier. Give your patients the best possible experience and invest in yourself. Very important for us from a global perspective. And we met another student, Mira Giulietta, who is a student at USC. And the message that she get across with us was, stay strong, stay positive, take care of yourself, and this helps your mindset and your mentality, especially during difficult times. It seems so simple, but it's that complex. We then met with Dr. David Fantarella with the Fantarella Dental Group in New Haven, Connecticut. Dr. Fantarella shared something that just blew my mind. Don't do what you don't want to do. Execute your processes to the best of your ability. Do it every day and do it better every day. What a wonderful sentiment. What a wonderful message. And we then got connected with Dr. Louis Kaufman, who is a Smile Source administrator. And his kind of touched me. Give yourself time to breathe. We get so wrapped up in so many things that are going on that when you give yourself time to breathe, it helps you refocus, kind of recalibrate you for the day, and it helps you get through that. So really appreciate that. And we met with Jennifer Zimmer, who is also with the Dentistry with a Smile in New Jersey. She works at the front desk. Every member, the message she gave us, every member of the dental team is important. You're not just X, Y, or Z. Every member plays a role in dental practice. And when people recognize that, amazing things happen. So we, from New Jersey, now we're in California, and we met with a registered dental hygienist named Cecilia Spellman. What a powerful lady and very focused. You're not alone. Her message is, don't let negative mentalities sit in your system, because they then affect you and your ability to do things. This message is very helpful, especially when things kind of get crazy and people aren't talking as much. Don't let negative mentalities in your system. Marie Ann Maringolo, who is an amazing singer, so you need to go check her out. The context or the message she shared with us was, express yourself. Express yourself. If you're not happy, let people know, but do it in a manner that's gracious. Share your gifts. She sang an incredible song for me, and I still go back and I listen to that. Dr. Brian Bilas in San Francisco with the 450 Aesthetics Dental Group. Wow. Amongst a lot of other things, the key point that he highlighted is how important budgeting is. Budgeting is key. Understand where all of those pieces go, because that's what's going to get you through when things get tight. And if you look at 2020, things got very, very tight. Then we met with Dr. Elaine Bilas. Holy cow. Dr. Elaine Bilas is part of the Innovative Dental Design Group in Glen Burnie, Maryland. And there's just a massive positive perspective and optimism that she shared with us. She got injected and all that type of stuff. And basically, her message is, we're going to get through this. We are going to get through this. It's just a matter of working through it. And then I've already mentioned Michelle Strange and her context about upping your infection control game. You know, she runs the A Tale of Two Hygienists podcast, and she covers some very powerful information there, very helpful. If you haven't had a chance to look at that, go look at it. But her focus on infection control, her focus on establishing good oral health for systemic health, she's been a champion for that forever. And it's just great to see that people are finally paying attention and we're all recognizing that. We met with Amy Roderick, who is also with One Manhattan Dental. And her context is that, you know, there's really no hierarchy in an office unless you put it in your head. Each job is important. Talk, ask for advice, share what you're dealing with, share what's good, share what's bad. And by doing that, it enables you to connect with each other, which is huge. Then we met with Dr. Arzu Bahar, who is at the Annapolis Prosthodontic Associates in Maryland. And her message is this whole idea of, you know, the human spirit is very, very powerful, and there's an ingenuity around it. And because of that, it gives us the ability to overcome and deal with problems. This is huge. This is absolutely huge. We met with Dr. Jay Resnick, who is a dentist down in Tarzana, California. He's an oral and maxillofacial surgeon. He runs or owns the California Center for Oral and Facial Surgery, and you know, the context around infection, duration, proximity, and time. And he educated me, at least, around donning and doffing, the effective way to do that. Really enjoyed the discussion with him. And he's got an online oral surgery site for education. Phenomenal, great information. We met with our good friend, Dr. Mark Hyman. Wow. Dr. Mark Hyman, he's a retired dentist, but he's now faculty at the UNC Adams School of Dental Medicine. The context, amongst other things, is spend your money to make dentistry easier. It will always pay back. And he's been a huge advocate for that. He lectures on that. His students love him. I also want to thank him personally because he's introduced us to some incredible guests here. And he continues to be a huge advocate for students, a huge advocate for other professions in industry. Phenomenal. I love the guy. He's amazing. We met with Dr. Emily McClellan, who is a pediatric dentist at Tooth Story in Manhattan, Kansas. And Dr. Emily shared with us this context of reach out and talk. And it doesn't necessarily have to be with your friends, with your team. It's important. As a leader, you have to also be able to recognize that people need that. Reach out and talk. And if you're upset, let people know you're upset. If you're happy, let them know you're happy. Don't be one-sided around that. Then, on the heels of that, we went with Dr. Kelly Tanner, who is also a registered dental hygienist. And the thing that I keyed in on that she shared with us is this whole context of courageous followership. In order to be an effective leader, you also have to be an effective follower. That was one of the pearls that we took out of that reminds us every day, hold on, am I as good a follower as I am a leader? Very important. Then we met with Sarah Lawrence, who's a registered dental hygienist and who's kind of transitioned out. And what she shared with us is this: There is life after dentistry, although dentistry is a very, very powerful and very important thing in her life. There is life after dentistry, and she's discovering that with the help of her dental peeps. So this is awesome. From there, we met with Laura Murphy, who's a registered dental hygienist, working with our inventor, Dr. Thomas Hirsch. And what she shared is that, you know, when you have an opportunity to work across different practices, you can see what works for you and you can see what doesn't. Do what works for you. And she said that's very important because if you're doing things that don't work for you, it's not going to last very long. That message came across very clearly when she was taking that. We met with Tina Calloway, a registered dental assistant, and by the way, she's also with the Armed Forces, and love the fact that she's doing that. But she works with the Kernersville VA. She's the first person out of the VA, and the message she shared with us, and that we pulled out, is this: trust your dental professionals. Trust that your dental professionals, your dentist, your DA hygienist, are doing the right thing. If you don't feel that they are, or your question, ask them. Have them tell you, because if they're not going to tell you, find somebody else. That's something that we all have a choice to do. And the message is very strong. Trust that your dental professionals are doing the right thing. Then we went with Mike Maroon, Dr. Mike Maroon. Who doesn't know Dr. Mike Maroon? He owns a practice, the Advanced Dental in Connecticut, and he's also a Smile Source administrator. The context of planning, the context of communicating, and all that is there. But the piece that pulled out with his advice is make sure your team knows exactly what it is that you are asking them to do. Don't assume that they do. The team needs to understand what you want to do and connect with them often. Because if they don't, they're going to do other things, and then you're going to be surprised. It was amazing. The Smile Source folks put on, during this entire thing, fireside chats, and that level of communication was incredible because it enabled them to share things that they're dealing with, ask questions, and then find out information that other people may know. We then met with Dr. Harvey Levy, a fellow martial artist, although he's way more of an artist than I am. And the message and what we learned from him, here's the thing: he got COVID. And although it kind of knocked him, he got through it. And he said, purposely take precautions. He purposely took space for his team in his practice instead of adding additional chairs because he recognized this is important. Love that message. And then Dr. John Camisi, good friend of Harvey's, and I love it when the two of them get together because they love each other, I think. But Dr. John Camisi is basically the infection control officer at the Medical University of South Carolina. And he is he is incredibly research oriented. Basically, his message to us was follow the evidence. Follow the evidence. If you're unsure, follow the evidence. And if you can't figure it out, there's a lot of information out there. And he said, it's just a matter of finding it. Take the time to find it, especially with regard to things like aerosols, infection control droplets, that type of stuff. And because of that research, he's able to provide clarity to his team, to other professionals. And it was great to hear that. We met with Dr. Jemima Poitevin, who's a pediatric dentist with Children's Dental Haven in Oklahoma City, Oklahoma. Here's her message. Don't try to do this all on your own. Ask for help from your team, from your friends. You can even ask for help from your patients. We're all people. We're all in this together. And by doing that, what it does is it establishes a much stronger community around you. Fantastic. Then we were introduced to Amanda Hill, who's a registered dental hygienist. It's amazing. She has such incredible energy, but she says she does run into things. And what really helps is this: using I statements instead of you. It enables you to enter into difficult and establish meaningful discussions with your team members, as opposed to pushing. Get the courage to talk purposefully. That's the message that she gave out, which is really cool. Dr. Brian Laskin, so he is an owner of Lake Minnetonka Dental. He's also the CEO of Upper DDS and the Chief Innovation Officer of Dental Care Alliance. This is his message: Technology is here to stay, and it can help. Embrace it. If you don't, you're not gonna. And he shared with us this context of how powerful technology can be in the dental practice, how important teledentistry is, and how it can basically expand practice's ability to do some amazing things. Then we have Dr. Paul Bilas, who's the father of Dr. Elaine Bilas. You can see that the apple or the peach or whatever doesn't fall far from the tree. Dr. Bilas is the owner of Innovative Dental Design in Glen Burnie. And if you look at it, his perspective is around having your team on the same mission and establish it. For them, it's patients first, practice safety, communicate, but most importantly, stay positive because you have a choice. You can either focus on the positive or not. And the alternative just isn't as great. So appreciate that context. We met with Dr. April Robinson, who owns the Robinson Family Dental in North Dakota. Dr. Robinson, I just want to say, talk about courage. Her message is struggles are real. And she shared with us that she was truly struggling and had the courage to do that. And because of that, and I just want to say it's wonderful. One of our dentists, she actually talked to Dr. Mark Hyman. And I'm blown away that he would take the time to reach out because of that and kind of help out. And it was nice to hear that they did that. And it's important to do that. Struggles are real. Not everything is awesome. And this is what life is about. Dr. Holly Ellis, train yourself to be a leader. You don't assume that you're just going to be a leader because you're the dentist in the office. You need to do training. She is also a member of the Smile Source organization, one of their administrators. And, ask for help. It's okay to ask for help to be a leader. Dr. Mary Smith shared with us that you can be successful in purchasing a practice during COVID. She is now the proud new owner of the Clayton Family Dental in Clayton, Missouri. And she actually purchased a practice, left group practice to start her own during a pandemic. So it's amazing the courage that she has, and it's really cool to see that. Stanley Bergman, thank you, Dr. Stanley, said some amazing things. So the key takeaway from his is infection control and PPE are the key to fighting diseases. Infection control and PPE are the key to fighting infections, not just COVID, all of them. And it kind of set a context for everything that's going on. From there, we met with Dr. Charles Schlesinger, Comfortable Dentistry for You in Albuquerque, New Mexico. Set a course. His message, set a course, stay the course. Set a course, stay the course. Don't get discouraged. Set a course, stay the course. And because of that, it's enabled him to overcome a whole bunch of things. And then Dr. Henry Silvestri, who used to run the San Mateo, she's since retired, the San Mateo Medical Clinic. Her feedback was this huge. Be aware of your surroundings because they affect everything that you're doing. When you're not, and you bypass things. We met Dr. Pavel Krastev from New Hyde Park, New York, wrote a book, The Power of Dentists, Fight for Peace. I love the sentiment behind him and the message he has around that. Dr. Mike Lighttongue introduced us to the context of the dental warrior and doing more with less. Invest in your team, show them how to do more with less, and you'll thrive, not just survive. Melissa Turner, registered dental hygienist, shared with us and gave us this context, the power of mobile dentistry. If people can't get dentistry because they're not going, bring it to them. And by bringing it to them, you're serving the community, serving patients. Huge story. Then we met Dr. David Rice with Ignite Dental. He said a lot of things. It was difficult to pick one out, this whole idea of planning and all that. But the one that we took out is this. Flipping the golden rule around. It's not about treating the people the way you want to be treated, because that's the way you want to be treated. The message he said was treat people the way they want to be treated. Talk to them the way they can hear what you're saying, the way they consume information. That was huge. Dr. Anna Vasquez, win. What's important now with pediatric, Fisher's Pediatric and Fisher's Indiana, work-life balance, and then maintaining your energy balance. Because if you don't have balance, if you're not focusing on what's important, you can't be effective with your team. And then Dr. Robert Laughlin with the LSU School of Dentistry. His message, it takes a team to get things done effectively. And because of that, LSU is on the forefront and doing some incredible things to keep everybody, patients, staff, you name it, completely safe and maintain the level of education at the school. And then Dr. Dan Roberts, who's a periodontist down in Encinitas, Perio, don't be afraid to deliver comprehensive dentistry. He's seeing fewer patients, but delivering comprehensive dentistry, which is enabling his practice to continue to thrive during this pandemic. And then finally, our last but not least, we met Sonia Dunbar Rdh, who is the geriatric tooth fairy, who has more energy than anyone you're going to meet. And her message, in addition to being a TEDx speaker, her message about every mouth matters. Don't forget our geriatric patients. So 48 people, 48 little pearls, but literally hundreds across that. I encourage you, if you have the time, when you have the time, go listen to what they have to say, because the message there is heartfelt, it's real. What do I want to close out to? First of all, on behalf of Zyris, on behalf of our team, on everything that we've done, really want to thank our guests. Really want to thank them for putting the thought, the real thought into sharing with us, to giving us the information, and for giving us time. Time is the most precious thing that we have here, and they gave us quite a bit of time. And now you all can go see it. So take the time to do that. The main sentiment is this. COVID has taught us kind of what's important to us, and that at the end of the day, we're all people, we're all humans. It's be real, be positive, be bold. It's important to work together, because by working together, we can move forward and overcome the issues that we're facing. By doing things alone, we're alone, and it can get really, really stressful, and that's the issue. Really important not to forget respect and grace for everyone we meet, because we don't know what they're dealing with. We're only focused on what we're dealing with. But by doing that, it enables us to recognize that we're in this together. Overarching message is that dentistry continues, absolutely continues to be one of the best professions that are out there, that dentists, their teams care. It's one of the safest environments, and that don't be afraid to go to the dentist. And because of that, I think, we're going to get through this, and 2021 is going to be an amazing and a phenomenal year for us. So there you have it. There you have it. Season 2 of Dental Voice. Really appreciate all the comments that we've gotten here. Really appreciate viewers who've come on to the show, the comments that we've gotten, and we're looking forward to continuing this. If you have any statements that you'd like to share, if you have questions that you'd like us to answer, if there are guests that you believe would be helpful in hearing from, let us know. We're coming up to the end of the year. It's almost, holy cow, it's almost December. And I think we're blessed to be doing what we're doing, meeting the people that we're meeting, and just getting to know each other is huge. By the way, before I close this out and kind of cover everything, Dental Voice is put on by a whole bunch of different people. And, I get a lot of kudos because I'm the person who's doing that. But I'm going to do something that's going to really piss her off. This is Lexi, everybody. And if you look at her title over here, she is the boss of Rolando. Lexi is one of our colleagues, and she is the producer for the show. And she's the person those of our guests, those of you who've been on the show, you've met Lexi. So I know she loves this, and she's like, I'm going to kill you, Rolando. You're doing this. But I want to personally thank you, because Lexi has been incredibly helpful in kind of helping frame things, keeping me, although it's not that easy sometimes, on the straight and narrow. So Lexi, thank you so much. Really appreciate that. So
yeah, thank you to all of our speakers for creating one of our most phenomenal seasons. Let's enter 2020 with a strong front and Dentistry is a great profession. 2021, yes, thank you.
Yeah. You know, I'm going to catch grief for this, but it's worth it because I can't tell you how much I appreciate working with her. So with that, if you like this content, please share. Have an incredible holiday season. Please spend time with your friends. Be safe, and we look forward to hearing from you, seeing from you, meeting more people in 2021. 2021 is going to be epic. So with that, happy holidays. Thank you so much. Great to see you all, and look forward to hearing from you. Take care.